For nearly 100 days, we managed to successfully delay the spread of the virus by locking down the country. We've had to enter into the lockdown, but now we are in a new and treacherous phase in the life cycle of this pandemic. As we can all feel it, the winter months are now here. And as we had earlier predicted, the number of infections is rising, and the infections are even rising at a much faster pace. A few months ago, many of us could have said that we didn't know of anyone who is infected or anyone who has died from coronavirus. That is sadly not the case any longer. Many of us now know someone. It can be a friend, a colleague at work, a relative, an acquaintance that we know who has now been affected in one way or another. We now have well over 150,000 confirmed cases of coronavirus, of which a third were recorded just in the last week. New cases are being reported everywhere and every day. We are in the midst of a new surge of infections. It is something that our scientists and doctors have warned us well in advance, and we are now experiencing it. But it is also being experienced in many other countries around the world. We've always understood that as more sectors of the economy open up and as more people return to work, this is going to happen. The reality is that we could not remain under lockdown forever. People need to earn a living. Learners need to continue with their education. Businesses need to reopen so that they can survive, and for their staff to also keep their jobs and earn a salary. The unemployment figures that were released recently are a great worry to all of us. It is urgent that we must restart the economy after this period of inactivity. The lockdown has enabled us to do a number of things. We've been able to deploy a vast network of community health workers and to scale up the screening and the testing as well. We've been able to strengthen our health care systems by making more beds available, building filled hospitals, opening up new ICU units, and also securing medical supplies and equipment that we didn't have. And as a result, we are able to handle the rise in infections and to treat and care for those who are infected. I must, however, say that our healthcare facilities are under a great deal of pressure. We must remember that to date, many people have also recovered from the virus. So those who go into hospitals are treated and get better and leave hospital. We've rolled out an extensive public awareness and education campaign about hand washing, mask wearing, and social distancing. And we've been spreading the message that people must wash their hands and wear their masks. We've been able to implement programs and policies to support businesses and our people, and particularly those who are also out of work. In the last few months, funds and skills and resources have been mobilized across society to tackle this enormous challenge. The Solidarity Fund, for example, has been vital in getting equipment and supplies to our frontline health workers. The 500 billion rand relief package has been provided to both strengthen the capacity of our healthcare system and to assist companies, but also to assist workers and households that have been badly affected by the lockdown. Banks and insurance companies are providing relief to many of their clients who are in distress. And all across society have also been assisted, but many people are also giving their time to support this cause that we are in of the COVID-19 pandemic. We have done everything we can to cushion our people from the ravages of hunger and poverty in the form of social grants and food parcels to vulnerable households. I know that many of you listening are afraid of what the future holds